UnitedHealthcare Ethics and Compliance exam questions and answers 100% scored. Question 1. On October 20th, Aries decides to switch his PDP that he had since January 1st to a Medicare Advantage plan. What election period will Aries need to use to get a November 1st effective date? Annual election period, open enrollment period, initial enrollment period, special election period if he qualifies for one. He may be able to use a special election period to change plans if he qualifies for one. Question 2. Mrs. Violet asks Agent Bob where she can find the star rating for the plan he has been presenting. Which statement is correct? Only by calling customer service, on Medicare.gov, the plan website, or enrollment guides. It is kept confidential, only mailed after enrollment. The plan's star rating is available on Medicare.gov, the plan's website, or in plan-specific material, such as the enrollment guide. Question 3. In which of the following situations can telephonic contact be made with a Medicare-eligible consumer? When the consumer consented to be contacted for sales activities and the permission has not yet expired. At any time during the annual election period. When the agent finds their number in a public directory. When the consumer is a friend of a current client. When the consumer consented to be contacted for sales activities and the permission has not yet expired. Question 4. Which of the following are examples of what an agent must review with a consumer prior to completing an enrollment application? Only the monthly premium, only the covered benefits, network characteristics, covered benefits, limitations, and plan-related costs, the agent's commission structure. The plan's network characteristics and how using out-of-network providers may impact coverage and costs, covered benefits and limitations, and plan-related costs such as monthly premium and copayments or coinsurance for services received. Question 5. When completing an enrollment application in Jarvis Enroll, why is an agent prohibited from entering their own email address in a field available for the consumer's email address? It will cause a system error. The consumer would not receive plan-related correspondence intended for them. The agent will receive too many spam emails. It will delay the enrollment process. The consumer would not receive plan-related correspondence intended for them. Question 6. By agreeing to the statement of understanding, the consumer waives their right to cancel the policy, agrees to pay the premium immediately, acknowledges that they clearly understand they are enrolling in a plan and know the specific plan, authorizes the agent to make future changes without consent. Acknowledges that they clearly understand they are enrolling in a plan, combined with knowing the specific plan in which they are enrolling. Question 7. When must the scope of appointment be obtained from the consumer for an in-person or telephonic sales presentation unless an exception applies? At the start of the appointment, no less than 48 hours before the marketing appointment, within 24 hours after the appointment, at least 1 week before the appointment. No less than 48 hours before the marketing appointment. Question 8. To complete an enrollment application on behalf of a consumer, what authority must the individual have? Must be a close relative of the consumer, must be a licensed healthcare provider, must be legally authorized under applicable law in the state to act on behalf of the consumer, must have verbal permission from the consumer. The individual must be legally authorized under applicable law in the state in which the consumer resides to act on behalf of the consumer. Question 9. Which of the following options will enable a consumer to obtain prescription drug coverage? Enroll in a Medicare supplement plan, enroll in original Medicare only, enroll in a PFFS MA-only plan and a standalone PDP, or enroll in any MA-PD plan, enroll in a standalone dental plan. Enroll in a PFFS MA-only plan and a standalone PDP, or enroll in any MA-PD plan. Question 10. What might happen if you rely on a benefit or plan feature a consumer mentions they saw or heard in an ad? You will find the best plan instantly. You might be tempted to skip doing a thorough needs assessment and be biased only toward plans with that benefit. You will get a higher commission. The consumer will be automatically enrolled. I might be tempted to skip doing a thorough needs assessment and or be biased only toward plans with that benefit. Question 11. Aries is currently a member of a standalone PDP. A thorough needs analysis indicates a Medicare Advantage plan would be a good fit. Which option is available to Aries if he is in a valid election period? He cannot change plans. He can enroll into a Medicare Advantage plan with prescription drug coverage, which will disenroll him from his PDP. He must keep his PDP and add a Medicare Advantage plan. He can only drop his PDP. Aries can enroll into a Medicare Advantage plan with prescription drug coverage, which will disenroll him from his PDP. Question 12. What is the purpose of a needs assessment? To complete paperwork faster. To gather as much information about the consumer as possible to ensure recommending the best fit plan. To sell the most expensive plan. To meet a quota. To gather as much information about the consumer as possible to ensure I am recommending the plan that is the best fit for the customer. Question 13. Which of the following must you ensure a consumer who is making a plan change understands? They must understand they cannot change plans again. They must understand what they are giving up and the benefits, costs, and limitations of the new plan. They must understand the agent's commission. They must understand how to use the online portal. I must make sure the consumer understands what they are giving up by enrolling in the new plan, and the benefits, costs, and limitations of the new plan. Question 14. Which of the following are examples of phrases that must not be spoken by an agent when a consumer is contemplating a plan change? Everything will be the same or nothing will change. Let us review your medications. Let us check your network providers. Here are the new costs. Phrases like, everything will be the same and nothing will change must not be spoken. Question 15. Can consumer Jean, who enrolled in a Medicare Advantage plan with a January 1st effective date, complete an enrollment application on February 15th for a different MA plan? No, he must wait until the next annual election period. Yes, he is still eligible to make a one-time change using the MA open enrollment period. Yes, he can change plans every month. No, unless he moves out of state. Yes, he is still eligible to make a one-time change using the MA OEP election, and his new will be effective March 1st. Question 16. Annual election period is a time when consumers can enroll in, switch, or disenroll from a Medicare Advantage plan or PDP, or switch to original Medicare. Only new Medicare beneficiaries can enroll. Consumers can only change their primary care physician. Agents can call any senior citizen. Consumers can enroll in, switch, or disenroll from a Medicare Advantage plan or prescription drug plan, or switch to original Medicare with new coverage effective January 1st. Question 17. What should an agent tell a consumer who asks what a 2-star rating means? The plan is excellent. The plan has received a below average rating. The plan is average. The plan is above average. That the plan has received a below average rating. Question 18. Which of the following is not considered prohibited unsolicited contact with a Medicare-eligible consumer? Calling them randomly, door-to-door solicitation, mailing a marketing brochure to the consumer via postal mail, approaching them in a parking lot. Mailing a marketing brochure to the consumer via postal mail. Question 19. Which statement about discussing benefits with the consumer before an enrollment is true? The agent does not need to mention network limitations. The agent must explain any provider and pharmacy network limitations. The agent should focus only on the positive benefits. The agent can skip this if the consumer is in a hurry. The agent must explain any provider and/or pharmacy network limitations. Question 20. While using Jarvis Enroll to complete an enrollment application, Agent Jeff learns the consumer does not have an email address. What should Jeff do? Use his own email address. Create a fake email address. Leave the field requesting a consumer email address blank. Tell the consumer they cannot enroll. Leave the field requesting a consumer email address blank. Question 21. The blank ensures that when consumers provide their verbal agreement during telephonic enrollment, they understand they are enrolling and in which plan. Scope of appointment, needs assessment, statement of understanding, summary of benefits. Statement of understanding. Question 22. Which of the following must an agent obtain from the consumer no less than 48 hours before an in-person, online, or telephonic marketing appointment? A copy of their Medicare card, a list of their medications, scope of appointment, a signed contract. Scope of appointment. Question 23. Jane is speaking to Albert about a prescription drug plan. Albert seems confused and is struggling to understand. Which option should Jane consider? Jane should pressure him to sign quickly. Jane should ask Albert if someone, such as an authorized legal representative, helps him make decisions and should be present. Jane should select the plan for him. Jane should end the call immediately. Jane should ask Albert if someone, such as an authorized legal representative, helps him make healthcare or insurance decisions and should be present. Question 24. What guidelines must you keep in mind when receiving a call from a consumer as a result of an advertisement they read or heard? The consumer may have misunderstood the ad or be relying on a single benefit description. The consumer is ready to buy immediately. The ad is always fully understood. The consumer does not need a needs assessment. The consumer may have misunderstood or been confused by what they read or heard in an advertisement, and may be relying on a single benefit or description provided. Question 25. Dennis is currently enrolled in Original Medicare plus a supplement plan. He wants to keep his current coverage but add prescription drug coverage. Which option is available to Dennis? He must drop his supplement plan. He should stay enrolled in Original Medicare and his supplement plan and enroll in a standalone PDP. He must enroll in a Medicare Advantage plan. He cannot add drug coverage. Dennis should stay enrolled in Original Medicare and his Medicare supplement plan and enroll in a standalone PDP. Question 26. A thorough needs assessment will include which of the following? Learning about current coverage, healthcare priorities, current providers, and medications. Only checking their budget. Only finding out their age. Only asking for their address. Learning about their current coverage, lifestyle and financial characteristics, identifying what is important to them and identifying their current providers and medications. Question 27. Inez called you after seeing a Medicare Advantage advertisement, but there is a lot of background noise. What action should you take to ensure she understands the information? Ask her to move to another room, speak clearly at a moderate pace, and ask if someone assists her with decisions. Shout louder into the phone. Talk faster to end the call quickly. Ignore the noise. Ask her to either move into another room or turn off the TV, speak clearly and at a moderate pace, and ask if someone assists her with making enrollment decisions. Question 28. Select 3 elements you must compare when a consumer is considering changing plans. Current coverage and costs, medication coverage and costs, and provider access compared to the new plan. Only the monthly premium, only the dental benefits, only the gym membership. The consumer's current coverage and costs, medications, and providers, compared to how access, coverage, and costs might be different in the new plan.